Hello, my name is Dr. Shoaib Javed Khan. I'm a consultant orthopedic surgeon at NASA Hospitals, Kasturi Nagar, Bangalore. Today, let us discuss a very common question about how fractures are treated. So, despite there being very different types of fractures, like we have displayed here, it can be a transverse fracture, an oblique fracture, a spiral fracture, comminuted fractures, linear fractures, avulsion fractures, and so on. Each fracture requires a certain type of treatment, but the most common rules, principles that we follow: any fracture first requires immobilization in the form of a cast, POP, or a splint. If the fracture can be treated with just immobilization, we stop at only a POP, a cast, or a splint. We keep that region immobilized for a certain duration of time depending on which bone has fractured. It can vary from weeks to months depending on the type of bone. The next more important thing is, when it is not a simple fracture, we might require reduction. Reduction means the bone itself is not in contact with the other end. For example, a fracture like this. Yes, so this fracture requires reduction. Reduction can be done in the form of closed reduction, wherein externally we only manipulate and bring the bone back to place to a required anatomical position where it is acceptable, and we apply the immobilization in the form of a cast, splint, or a POP. So it can also be open reduction, wherein certain bones, even if reduced, they go back and they displace again. So these kind of bones require surgical correction, wherein you bring the fragments together in place and externally place some device to help hold it. For example, a plate, screws, or a nail with screws, anything. So the second point would be reduction. Third is angulation. So let's discuss another very simple example, which is a fracture of the hand. Yes, we have two bones in our forearm, being the radius and the ulna. So let us discuss two types of radius fractures. So the distal radius fractures in particular. All right. So this is the radius which has broken here. It has fractured. And Colles fracture is a particular type of fracture wherein there is distal radius fracture with dorsal angulation. This basically means this is our dorsal end and the bone has broken and moved upwards towards this side. So it would look something like this. Yes, it would look something like this. So there's a dorsal angulation. These kind of fractures are also called dinner fork deformity. They have, which means the hand would look like a dinner fork. So this fracture requires reduction because of the angulation. So it can be done in the form of reduction manipulation and applying a special type of cast, which will be in the opposite direction, which will be in a volar cast. There's also the exact opposite, which is called a Smith's fracture, wherein this distal radius is actually having a volar or a palmar angulation. Yes, in similar fracture, again the cast should be placed in a way that angulates this back into place after reduction. So we have spoken about immobilization, we have spoken about reduction. Angulation requires to be corrected, and in cases where this is not possible, we have to opt for surgery. We at NASA Hospitals, Kasturi Nagar, Bangalore are here to help you in any form and manner. Our services are open to you. Please do come visit us. Thank you.